for choosing Biophilia. I hope this helps you to make your studies a lot more easier. Before making concepts very clear, do like, share and subscribe to our amazing channel and do hit the bell icon to get notified for the upcoming videos. So as a good habit, Biophilia ensures that you have a brief look at the previous topics for the perfections in the next. So we would be revising about the last video that we had covered about this chapter, and then we would be proceeding further with the new topic. So let's recollect about the brief highlights for the previous topic that we had covered, which included about blood vessels, walls of blood vessels, double circulation, circulation through special pathways जो हमने देखा था, that was about portal systems, and then finally we concluded the video with understanding of control and coordination of heartbeats. So heartbeats कब increase होते हैं, what is the reason behind the increase of heartbeats, and when the heartbeats decrease and what is the reason, how does body react to those, all such things we had covered in the previous part of this chapter. So if you want to revise or if you want to read those topics in detail, you can go and check out our previous video. I will link down the video link in the description box. You can go click on that and view that previous video. हमारे channel Biophilia पे we have many more videos related to 11th and 12th class biology, so you can go and check those out also. So let's move on with our fresh topic for this video. So let's get going. So now let's discuss about the fresh new topic for this video, that is electrocardiogram, जिसको हम ECG के नाम से भी जानते हैं. So what is this electrocardiogram? This is nothing but a graphical representation for the electrical activity of the heart during a cardiac cycle. So from the previous videos you know that cardiac cycle जो होती है that is for about 0.8 seconds. So that was a revision point. So ये 0.8 seconds में whatever the electrical activity because of the SA node and the AV node happens, that is going to be recorded in a form of graphical representation. That is nothing but called as electrocardiogram. So now you know what is ECG. But ECG जैसे ही there are two more terms that you can come across, that is electrocardiograph. So now to remember that, हमने जो पहले graphical representation की बात थी, in that it was electrocardiogram, and what we are seeing now is electrocardiograph. So you need to pay attention that what has been asked. अगर electrocardiograph की बात है, then it is going to be the machine that is used for taking out the graphic representation. But if the term comes electrocardiography, graphy is related to the technique that is used or the process that is used to get the graphical representation, that is the electrocardiogram. So ये three terms, many people get confused between these three terms when they come together, but now I hope that you are not going to get confused because we have listed them down together. So you can also note them down and keep in mind that gram is related to the output, that is the graph. फिर graph जो actual term graph आता है, that is not the output, it is the machine that is for the output, and graphy is related to the technique. Now coming to who invented or who discovered this technique, that is electrocardiography. So it was because of Beethoven, which he had introduced electrocardiograph or electrocardiography, that is ECG. अब ये ECG के लिए when a person or a patient goes into the hospital or a clinic, then how is this ECG recorded? So the patient is going to be connected through three electrical leads. So you must have seen like these, there are three little pads which are connected to wires, and these are going to be placed, stuck onto three places on your body, that is the right wrist, left wrist and the left ankle. So जब ये sticky pads with the electrical wires are placed onto your body, and that time the pads are going to read the electrical activity, and that would be recorded in a form of ECG. So Now here, whatever you see, all those lines coming up onto the paper, these are nothing but the records of your heart activity. So now you don't know what these activities, whatever is put on the paper, you can't understand that. But after this video gets over, you are going to be master to understand these little lines that are drawn onto this ECG. So let's get and know about what these lines actually mean. So now let's understand what these lines or curves onto this graph of ECG actually show. So ECG के जो curves होते हैं, they are divided into three major parts. So first part होता है that is called as the P wave. अब P wave किसे बोलते हैं? P wave is going to be this little part that has a little bump, that is going to be the P wave. So अब ये P wave exactly what does it signify? So it must be clear that P wave is going to be showing the timings or the electrical activity during the excitation of the atria. Whenever the atria gets the signals to contract, at that time this is the depolarization or the excitation of atria that leads to contraction. तो वो जो state होता है that is recorded by the P wave. अब second part जो आता है that is called as the QRS complex. So here you can see onto this photograph that the Q, R and the S, that part is going to be the next of this ECG recording. So QRS complex is going to be the time wherein the depolarization of ventricle occurs. So depolarization of ventricles की वजह से क्या होता है? The ventricular contraction is going to occur. So जब ventricles contract होते हैं, when they undergo ventricular systole, at that time the depolarization occurs. And when that occurs, the electrical activity is being recorded by the QRS complex. अब जैसे ही contractions start होते हैं, how are you going to, as a doctor, how does he understand? So contractions of ventricles जो perfectly जब start होते हैं, it is going to be after Q. So here if you can see closely that after the Q, after P wave, there is going to be a short depression and then there is a hike. So that is going to the place wherein the contraction of ventricles occur, and that marks the beginning of systole. So that was about QRS complex. Last part आता है that is the T wave. अब T wave कहाँ होती है? T wave is the last part of the ECG recording that signifies and complete one cardiac cycle. So last, that is T wave, is going to be the activity that records the return of ventricles from the excited state. तो contraction के टाइम पे क्या हुआ था? They had been depolarized और excited state में थे. So when they come back to the normal state, that is repolarization, at that time it is going to be recording the T wave. So जब T wave end हो जाती है and when the beginning of the new P wave starts, between that there is going to be a marking that is end of systole. So systole जब end होगा, the T wave is also going to end. So that brings us to say that one cardiac cycle has been completed. So एक cardiac cycle को जब ECG में record करेंगे, that would show you P wave, QRS complex and the T wave, and then again as the cycles increase, these waves are going to keep on repeating. So that would give you a long ECG report that a person has gone under. So ये सारे चीज़ें is normal conditions. Now there can be different conditions when the ECG is not normal, and now we are going to discuss how that things occur. Now let's get some practical knowledge about the ECG reports. So if you get a chance to hold the ECG report and previously without this information आपको सिर्फ ऐसे ही लगेगा that these are lines made on the graph, but no, after reading this video and understanding it, you can identify some of these ECG reports and try to relate those topics to the reports that you are holding. So let's see what you can understand from it. First of all, you can understand by counting the QRS complex. So QRS complex you can identify from the ECG reports. So अगर ECG reports में if you can identify the QRS complex, then you can count those QRS complex and then you can understand the heartbeat rate. So जितने QRS complex होंगे in the given period of time, then that many period of time में the heartbeat rate can be calculated. So if you count the QRS complex, that is directly the number of heartbeat rate. So that was the first knowledge that you can understand from the reports. अब सब देखेंगे कि abnormalities में आप कैसे पहचान सकते हो that person is not well and he has some problem. So first आएगा that is enlargement of P wave. So now you know what the P wave is. So if the P wave in the normal conditions is a bit slightly bump, but if it is enlarged, so enlarged condition में you can understand that it is because of enlargement of atria. So atria enlargement किसकी वजह से होता है? It can be because of high blood pressure, that is hypertension, या फिर अगर mitral valve काम नहीं कर रहा है, if there is narrowing of that valve, then also there can be enlargement of atria. And third reason हो सकता है कि अगर left ventricle is not functioning properly, then to adjust the functioning, the left atrium is going to increase the pressure to fill the ventricle. So उस condition में भी the enlargement of atria can be observed. Now generally the left atria is going to be more enlarged than the right atria. So enlargement generally left atria का common होता है, but right atria का enlargement B can be identified. So the doctors can go through the CT scans, MRI scans of your heart, and they can understand where the enlargement is there, whether in left atria or the right atria. So that was about the second case that you can see. थर्ड केस हो सकता है that is enlargement of Q and the R wave. If there is enlargement of Q and R wave, that can indicate the condition that is myocardial infarction. What is myocardial infarction? That is a medical term given for heart attack. So if someone has undergone heart attack and if it gets recorded in the ECG, then it can be recorded as enlargement in Q and R wave. So you can see in the photograph that Q and R wave are going to be enlarged, showing a sign of myocardial infarction. Next case is going to be wherein there is elevated ST segment. So here in the photograph of ECG reports, you can see there is a normal ST segment, and here you can see the elevated ST segment. So elevated ST segments can also refer to myocardial infarction, that is heart attacks. नेक्स्ट देखेंगे if instead of enlarged or elevated ST segment, अगर ST segment depressed है, if it goes below, then what is going to be identified? It can be identified that the heart muscles are not receiving sufficient oxygen. अगर oxygen supply is not good for the heart muscles, then your ECG reports can show that ST segment is depressed. Next is going to be the condition wherein the flat T wave is found. अगर T wave flat है, so normally the T wave should be on the higher side. But if it becomes flattened, then you can relate to it that the heart muscles are not receiving sufficient oxygen, और sufficient oxygen नहीं मिलने का और एक केस होता है, that is erythrosclerotic heart disease. So the person can even suffer from this, and that can be caught in the ECG report as a flat T wave. Next condition है that is reduction or inversion of T wave. अगर जो curve है, that is the peak of the T wave, if it is decreased in size or it has get inverted, in the both cases it can refer to a condition that is called as coronary ischemia. Now here to remember the reduction of size in T wave is going to be a very important part to remember because it had been asked in NEET 2019. So this has been a question that if there is reduction in size of T wave, then it is a condition for coronary ischemia. So that is an important point. So अगर पहले previous year questions में if they have asked about this, they may ask other questions from these topics as well. So you must get ready with all those other things as well. Last final आएगा about this practical knowledge, that is when a person, if you must have seen movies or some other shows जहाँ पे medical hospital scenes are shown, तो आपने अगर देखा हो या even in real hospital scenarios, you must have seen the monitors are attached to the patient. So if monitor starts, in normal conditions, it is beeping like beep, beep, beep. It keeps on beeping to record the heartbeats. But suddenly, if it starts beeping faster and then it sounds like beep, beep, beep and beep, then what do you understand? That the patient has undergone cardiac arrest. So you must have seen कि अगर normal conditions में there are going to be heartbeats that keep on and then suddenly there is a flat line. And that flat line is going to indicate that the person has undergone cardiac arrest and it is a time to call doctors to revive that patient. So that was the last part to understand about ECGs. Now let's discuss about some disorders of circulatory system. So the first and the most common disorder for this system, that is hypertension, or also called as high blood pressure. So you must have all heard about this in some or the other part of your life. So high blood pressure or hypertension is very common क्योंकि आजकल in fast lives and the workload that the people have, because of that many people suffer from hypertension. But you must have heard that name, but what does hypertension actually mean in medical terms? So normally your blood pressure should range about 120/80. If this condition is not seen nearby for many long repeated checks, and if your blood pressure is showing 140/90 or higher conditions, then you are going to be diagnosed with a common disorder, that is hypertension. So yeah, hypertension can be treated, it can be cured with the help of tablets or other sources. They can be cured, but if they are untreated or left unknown, so that can lead to heart diseases. It can also affect to vital organs क्योंकि वहाँ पे भी the blood is going to reach at a higher pressure. So your brain and your kidney can also get damaged because of high blood pressure. So you should not ignore the high blood pressure symptoms. So you can go and check the blood pressure at your nearest doctor and get it checked. So if it is more than 140/90 or higher for repeated checks, अगर एक बार आ रहा है, then it is not the case of high blood pressure, but it is repeatedly showing the values higher than that, then that can be a case of hypertension. Next is going to be erythrosclerosis. So this disorder is the case wherein there is built-up of fats, cholesterol or other substances. So अगर artery walls के ऊपर ये सारे substances आके clot हो जाते हैं, they form a plaque. In that cases, there is going to be restriction of blood flow. If the blood flow restricts, what is going to happen? Indirectly there are going to be many other problems. So अगर lumen इतना होना चाहिए था, and if it gets deposited, it is going to narrow the lumen down. If there is narrowing of lumen, what is going to happen? The same conditions. अगर एक pipe है wherein the water is flowing, and if you press that pipe, what is going to happen? The lumen is going to decrease and the water comes at a higher flow, moving out everywhere. So that is the same case if erythrosclerosis is happening. The deposition is going to narrow down the lumen from where the blood is flowing. So you can see in the photograph that how the deposition is going to narrow down the space. So that is going to decrease the blood flow and cause several other problems. Now next, अगर ये erythrosclerosis, if it is happening in the coronary arteries, that is the arteries that supply blood to the heart. So अगर heart के related arteries में अगर ये ऐसे narrowing down हो जाता है या if there is blockage of those arteries, then the new term for that is called as coronary artery disease. So that is going to be same as erythrosclerosis, but it is occurring in the coronary arteries. So a new name, that is coronary artery disease. Then is going to be angina pectoris. Angina pectoris is ऐसी condition है wherein there is acute chest pain. There is a severe chest pain and it appears when there is no enough oxygen. अगर वो person who is suffering from no oxygen or no enough supply of oxygen to the heart muscles, so there is a very extreme chain pest, and this extreme chest pain is going to be a symptom that is called as angina pectoris. So you must have seen in Bollywood movies wherein the father of the bride suffers from sudden heart chest pain. That is nothing but angina pectoris. So this severe chest pain is regarded to be the second largest pain. So first largest pain, that is the labor pain. So after labor pain, this is the most deadly pain that occurs, that is angina pectoris. Now here, this is the sequence that generally when the patients delay their symptoms like coronary artery disease, अगर plaque या cholesterol ज़्यादा होने की वजह से when these arteries get built up the plague in them, what is going to happen? Slowly and suddenly there is going to be deposition, और वो deposition की वजह से there is going to be narrowing down of the arteries, and when that happens, so the clots are going to be formed in each and every artery most of the times. So अगर वो heart के arteries को अगर they get targeted, then there can be a next stage, that is heart pain, that is angina. And because of that heart pains and the clots that have been formed in those arteries, there can be heart attack. So now we are going to understand about heart attack. So ये heart attack हमने बहुत बार सुना है about heart attack, that is also called as myocardial infarction. What is this actually? Heart attack is nothing but a dead of part of a heart muscle. Heart muscle का एक part अगर dead हो जाता है because of stoppage of blood supply, अगर blood supply नहीं होती है, that is oxygen is not reaching that part of the heart, and because of that no oxygen condition, that heart muscle is going to die. So when that heart muscle dies, the person suffers from heart attack. So as you can see in the photograph, the black colored portion is the dead part of the heart muscle, and that is nothing but heart attack. नेक्स्ट टर्म हमने सुना होगा, दैट इज हार्ट फेलियर. हार्ट फेलियर को कंजेस्टिव हार्ट फेलियर भी बोलते हैं. कंजेस्टिव बिकॉज इट इज रिलेटेड टू कंजेशन इन लंग्स. सो व्हेन द हार्ट डज नॉट पंप ब्लड एफिशिएंटली, अगर पंपिंग ऑफ द ब्लड इज अफेक्टेड, देन दैट इज कॉल्ड एज हार्ट फेलियर. जबकि हार्ट अटैक क्या था? हार्ट अटैक वाज डेथ ऑफ अ पार्ट ऑफ muscles of the heart. अगर muscles damaged है because of the death, that is heart attack. Heart failure में pumping efficiency has been decreased. So not to get confused between heart attack and heart failure. Next term that comes is heart block. Again, third term that has heart, but these all are different. Heart attack, heart failure, heart block अलग अलग है. So what is heart block now? Heart block is going to be a condition wherein the impulse that is traveling, जो electrical impulse action potentials जो pass होते हैं from the SA node to the AV node से for the Purkinje fibers, all that अगर वो सारा interrupt हो जाता है, if there is no normal supply of that action potentials, in that condition there can be heart block. So heart block दो type के हो सकते हैं depending where that impulse is not reaching. If it is not reaching AV block, so AV block में अगर वो AV node के पास नहीं पहुंच पा रहा है signals, then it is a AV block. अगर एक branch of the bundle of his has been blocked, in that case that is a bundle of his block. Now these are the two types of heart block. नेक्स्ट टर्म आता है दैट इज कार्डियक अरेस्ट. अब कार्डियक अरेस्ट क्या होता है? कार्डियक अरेस्ट इज गोइंग टू बी अ कंडीशन वेयर इन द हार्ट इज गोइंग टू सडनली स्टॉप बीटिंग. Now when it suddenly stops beating, what is going to happen? There is going to be loss of blood flow, and because of that loss of blood flow to the heart, the beating or the pumping of the heart is going to stop suddenly. So just sudden stopping of the beats hota hai, that is nothing but cardiac arrest. Now a difference between cardiac arrest and heart attack is cardiac arrest जो होता है that is a electrical problem. वो एक्शन पोटेंशियल्स नहीं पहुंचने की वजह से देयर इज कार्डियक अरेस्ट. बट हार्ट अटैक इज अ पंपिंग प्रॉब्लम बिकॉज हार्ट मसल्स गेट डेथ. सो हार्ट मसल्स के डेथ की वजह से द पंपिंग इज affected, that is heart attack. So these are the four important terms that people get confused between. So I have tried to list them down one together so you can understand the difference between these. So these are very important: heart attack, heart failure, heart block and cardiac arrest. They sound similar but have a very large difference that you need to understand. So now the next is going to be cerebrovascular accident, जिसको हम stroke के नाम से भी जानते हैं. So this stroke is nothing but when a part of your brain does not get blood flow because of either blockage of the blood vessels or the rupture of the blood vessels. So अगर blockage हो जाता है then it is one type of stroke, that is ischemic stroke. This stroke, the clot is going to block the way for that blood vessel and that particular part of brain oxygen नहीं मिलने की वजह से there is going to be damage for that part of brain. Second case हो सकता है for the stroke that is called as hemorrhagic stroke, जहाँ पे rupture of the blood vessel की वजह से there is internal bleeding seen in the brain. So these are two types of stroke that can occur, also called as cerebrovascular accident. नेक्स्ट कंडीशन होता है दैट इज रूमेटिक हार्ट डिसीज. रूमेटिक हार्ट disease is going to be a condition wherein the heart valves are going to be permanently damaged. So this damage is going to be because of rheumatic fever. So अगर ये fever if the person has, he can have the disease of rheumatic heart disease wherein the heart valves are going to be permanently damaged. So you can see in this adjacent photograph wherein you can compare the normal and the diseased condition for the open as well as closed condition for the valves. So now let's see the next disorder, that is fibrillation. So fibrillation जो है, it is a irregular heartbeat. So this irregular heartbeat can be a cause because of stroke or a heart failure, और even it can be because of blood clots. और भी बहुत सारे reasons होते हैं related to heart that can cause irregular heartbeats. So when the person has irregular heartbeats, it is fibrillation condition. So fibrillation can be recorded in the ECG and the person, that is the doctor, can understand that the person is suffering from fibrillations. So fibrillations में क्या होता है, there are going to be irregular amounts of electrical signals sent by the nodes. So ऐसे node से AV node से there are going to be mismatching of those signals, and you can see in this particular GIF wherein the normal condition में the yellow dots represent the electrical impulses sent, जबकि अगर fibrillation के case में you can see there is a lot of mess going on with the electrical signals, and that is nothing but the case of fibrillation. So how can this be treated? This can be treated by the shock. So जो shock देते हैं, so you must have seen in movies, or generally people don't allow to see this in real life, but in movies you must have seen this little device and the shock that have been given. So वो जो shock दिए जाते हैं to that patient, that is because of irregular heartbeats, so that they can be coming back to normal rhythm. So with this you can see this ECG report wherein because of fibrillation, between this first graph you can see that the person was undergoing fibrillation. जैसे ही the person was treated with the shock, at that time it had been recovered to get the normal heart rhythm at the third phase. So that was about fibrillation. Now let's see some important medical terms that you should know while learning this particular chapter. So first term आता है, that is tachycardia. Tachycardia is referred to when the heartbeat rapidly increases. When the heartbeat increases, that is above 100 beats per minute, in that case your ECG reports can be a bit different. So in that case the doctor can use the term that is tachycardia. Next word आता है, that is bradycardia. Bradycardia is the term used when your heartbeat decreases slowly. So when there is decrease, that is fewer than 60 times per minute, then the term is used as bradycardia. Next term होता है, that is aneurysm. Aneurysm is nothing but abnormal widening or ballooning of the blood vessels. So जब blood vessels फूल के balloon जैसे हो जाते हैं because of weakness in the walls of those blood vessels, in that case you can see in this photograph that how the blood vessel is going to blow up like a balloon. That is nothing but the condition that is aneurysm. Next होता है, that is varicose veins. Varicose veins is also a common term that you must have heard in your families. So varicose veins जो होते हैं, that is because of accumulation of blood in veins. So ये generally legs में होते हैं because when the person stands for a long time, and in that cases the person is most likely to suffer from varicose veins. So because of standing, that is anti-gravity, the blood needs more pressure to raise up high. So in that cases there is going to be abnormality in the valves in the vein. So normal vein में the valves are going to function properly, जिसकी वजह से the blood flow circulation is proper. But when the person stands for a very long time, for longer period, then what is going to happen? There is going to be accumulation of the blood in your lower legs, and that can cause the varicose veins. So now let's understand about artificial pacemakers. So artificial pacemakers क्या होते हैं? These are medical devices that are used to generate electrical impulses. So जो काम your natural pacemaker, that is the SA node functions, अगर वो damage हो जाता है और if there is some problem in that natural pacemaker, then the artificial pacemaker is installed. So that is going to help you generate those electrical impulses which are going to be delivered by the help of electrodes. And when these electrical impulses are delivered, your heart muscles are going to get those messages, and it will start pumping and relaxing to pump the blood throughout your body. So the problem is solved with the help of artificial pacemaker. So these pacemakers can be implanted to help control your heartbeat. So if your heartbeats are abnormal, if they are irregular, in all those cases the doctor can suggest to install a artificial pacemaker. So artificial pacemaker can be installed or implanted under two conditions. Either it can be a temporary implantation or it can be a permanent implantation. So temporary कब suggest किया जाता है? When there is going to be a slow heartbeat treatment, and slow heartbeat generally it can be occurring after a heart attack or a surgery related to heart, or if there is a medication overdose. In all those cases the person can be asked to implant temporary artificial pacemaker. Permanent pacemaker की ज़रूरत तब पड़ती है when the person is going to need correction for slow or irregular heartbeat. So slow or irregular heartbeat के केस में permanent pacemaker is going to be the best treatment. Otherwise there can be a second option when the permanent artificial pacemaker is needed, that is heart failure. So if heart is not able to pump properly, in that case the artificial pacemaker is going to do the work to send signals to pump, that is contract and relax the heart muscles efficiently. So you can see in the photograph how that artificial pacemaker looks and how is it placed or implanted into the patient, that is going to help have a better life. So वैसे ही artificial pacemakers, they are going to help control the heartbeat and give a temporary or permanent solution to the patient. So with this we conclude our chapter to get finished over here. So जैसे ही artificial pacemaker have been understood to you clearly, you have completed the chapter of body fluids and circulation. So if you like all those clinical and the practical knowledge about this chapter, so do like, share and subscribe and hit the bell icon to meet in the next chapter video. Till then you have to keep studying, keep smiling, stay motivated. Thank you.